In my current role, I take a lot of students, so reflective practice comes quite easily to me because I have to reflect with the students and their understanding of what they have been doing and how it went and what they could do better. So reflective practice comes quite naturally to me at the moment. In my previous life as a public health physio, I had a really good mentor, and I had some difficult patients who weren't engaging or weren't getting better, and I was putting in a really big effort with them. And he told me to take the half an hour drive on the way home as your reflective time, and then as soon as you step out the door, stop reflecting, stop being a physio, start being yourself, and make sure that you have a really big distinction between life and work. So I use that as my reflective time, and it's a really healthy way of making sure there is a separation between your work and your life and that you have that balance. I think it's really important to reflect, because if you don't reflect, you can't improve. I think it's really stressed on students, and I remember when I was a student, it was stressed that we fill out the paperwork at the end that said, oh, please reflect on your prac experience or how you went or what happened. And I kind of just put in the things that were expected, like, I thought that was challenging, I thought that was difficult, but it's not until you have a really challenging or difficult experience as a professional where you realise how important that reflective process is and how much that can improve your performance next time.
Yeah, I think reflection is just so important. I think every day you're going to be confronted with situations that might be unfamiliar or different, that you feel you might not have dealt with it as well as you could have, that potentially an error has happened, potentially someone has been harmed, and you have to go away and deal with all of that. And as a student, sometimes that can be really hard because you feel like you've done your best and you feel like you did everything you could, and you're scratching your head wondering how one thing led to another or something happened, and that's fine, it will happen. I think it's a lot of things. It's talking to the people you work with, talking to people who are already qualified and learning from what they have to offer, having a debrief about it and actually talking about it, because that's the only way you're going to be able to prevent it from happening in future and actually learn from it. Looking at what's out there online, through your textbooks, whatever resources are out there and guidelines that are out there, so that you have something to go to, so you know what's available, so that you're making an informed decision in future is going to be really important. I think talking to students as well, other students who you are studying with, because sometimes as a student, you don't want to step on anyone's toes. You feel like you maybe only have a bit of a narrow scope, and yet you're making some big decisions and you have a lot of responsibility. So sometimes talking to other students can be really helpful, because they might have similar experiences, or they might have worked with other people who have dealt with things differently, and they might be able to give you some really helpful advice. But I think as well for yourself, just going away and taking some time to reflect on how you dealt with things, whether in your head you feel confident going forward, and whether that's a learning point for you that you need to go away and do some more reading about that area. I think that whenever you come across an area that you feel perhaps intimidated by or really shy about, and you don't want to engage with it, that's really a sign that that's an opportunity for you to upskill. That's an area that maybe you're not as strong in, and you need to go away and do some work on it. Because you shouldn't feel like if you're intimidated by an area that you shouldn't engage with it, because you're going to come across those patients time and time again. Probably if you're avoiding it, you're probably going to come across it even more. So just knowing that there's guidelines and there's people out there who are able to help you, even in your studies, other students, talking to your lecturers and your tutors, it's going to be so helpful. So just take on all of those resources and those people who are available to you and learn as much as you can from them, because unfortunately mistakes will happen, but it's about them being proactive and actually doing something about it, so that in fact in future you might be really super amazing at dealing with that situation in future.
Reflective practice, how it works in practice, it works great in a multidisciplinary team, because when you're not sure of what you're doing or questioning yourself, you can ask other disciplines who might have similar experiences. I also find reflective practice works really well if you get client feedback. You know, when you're a clinician, yes, you take objective outcome measures because we need objective measures to prove programs work, to show improvements to GPs, to the clients themselves, but you also need that subjective feedback. Subjective feedback is what people say, how they feel, how they react. That stuff's invaluable. Just because someone's improving doesn't mean they're enjoying it. Just because someone's declining doesn't mean they're not adhering to what you're prescribing. So client feedback, you know, it doesn't have to be a novel. It can simply be a one-page questionnaire on what the clients are finding challenging, what the clients are enjoying, and what the clients are doing. And then once again, if they're engaging in any other programs or interventions, just so that maybe it's not you, maybe it's not happening in your gym environment program setting. Maybe it's something outside, something external, but the more you can get from the client, the more then you can make sure A, your client's centered, and B, you're going to get the results both you and the client is after.
I don't take notes on what I need to do. If I've stuffed up a doctor's meeting and I've said the wrong words, or I've said something that may mean that they don't want me at that doctor's centre, or that the doctors weren't as happy to refer to me from what words I've said, then I'm just going to make a mental note of that and say, next time I do a doctor's meeting, I'm going to make sure that I don't say that specific word to them, because that wasn't well received within the medical fraternity group. And as a result of that, next time I go in, I'll just make a mental note to myself, what did I do last time? And I'll just reflect back on that and the outcomes that I've processed after I had that meeting, and then change that for the next thing. And if it's something like a medical condition or something in treatment of patients, then I more specifically may write notes in terms of a patient handout that I can review before a patient with that comes in next time, and then I can have all those specific dot points down without meandering around and needing to do all the research again.